Hello friends, and welcome back to the channel. Now I need you to stop whatever you're doing right now and give me your full attention for the next few minutes, because what I'm about to share with you is genuinely time sensitive. And I don't say that to alarm you, I say it because the information in this video involves real deadlines, the kind that once they pass, you cannot go back and undo. Here's the situation. Right now, across the United States, millions of seniors are at risk of losing benefits they've worked decades to earn. Not because of anything they did wrong, not because the programs are going away, but because there are deadlines attached to these protections, enrollment windows, application cutoffs, annual review periods. And when those windows close, they close hard. We're talking about Medicare coverage decisions that lock you in for an entire year. Social Security filing choices that affect your monthly income for the rest of your life. Benefit programs with annual application deadlines that most people don't even know exist. Low-income assistance programs that reset every year and require reapplication, and new policy changes that took effect in 2025 and 2026 that are already affecting what seniors receive, changes that require action to take full advantage of. If you've been putting off looking into any of this, today is the day that changes, because the cost of waiting isn't just inconvenience. In many cases, it's thousands of dollars, sometimes tens of thousands. Stay with me all the way to the end of this video, because the final point we cover may be the most urgent of everything we discuss today. Now let me tell you exactly what we're going to walk through. I've done the research. I've gone through official program guidelines, federal and state policy updates, enrollment rules, and recent legislative changes. What I'm going to share with you today are 5 critical areas where seniors face real hard deadlines in 2025 and 2026, and what you need to do before those deadlines arrive. This isn't general retirement advice. This is specific, actionable information about programs and decisions that have time limits attached to them. And most people, even people who consider themselves well-informed, are missing at least one piece of what we're going to cover. If you're not subscribed to this channel yet, I want to ask you to do that right now. Every week we cover exactly this kind of material: benefits updates, policy changes, financial programs, legal rights, the things that directly affect how much money you have and how secure your retirement actually is. The people who subscribe stay ahead of these changes. Hit that button now, and let's get into it. Number 1. The Medicare open enrollment deadline and the costly mistake millions make every single year. Let's start here because this one affects more seniors than almost anything else we could talk about, and the misunderstanding surrounding it is enormous. Medicare's annual enrollment period runs from October 15th through December 7th every single year. During that window, you can switch from original Medicare to a Medicare Advantage plan, switch back the other way, change your Part D prescription drug plan, or make other coverage adjustments. Whatever you choose during that window takes effect on January 1st of the following year. Here's the part that catches people off guard. Whatever you are enrolled in when that window closes on December 7th is what you are locked into for the entire following year. If your plan raised its premiums and you didn't switch, you're paying those higher premiums all year. If a medication you depend on got dropped from your plan's formulary and you didn't catch it, you're paying out of pocket for that drug all year. If a better plan became available in your area and you didn't know to look, you missed it. And this is happening to people every single year. Not because they're careless, but because the system is complicated and the number of plan options available in most counties is overwhelming. In some parts of the country, Medicare beneficiaries have access to dozens of different Advantage and Part D plans, each with different premiums, different drug coverage, different networks of doctors and hospitals. Comparing them takes time and attention, and most people simply renew what they have without looking. What does that cost? Studies have consistently shown that Medicare beneficiaries who actively compare and switch plans when better options are available save an average of hundreds of dollars per year, sometimes over $1,000, just in premiums alone. Add in drug cost differences and out-of-pocket maximums, and the gap between an optimized plan and a default renewal can be substantial. What do you do about it? Every fall, before October 15th, go to Medicare.gov and use the Plan Finder tool. Put in your actual medications, your preferred doctors, and your zip code. Let the tool show you what plans are available and what your estimated annual costs would be under each one. If you want help, call 1-800-MEDICARE or reach out to your state health insurance assistance program, SHIP, which provides free, unbiased counseling to Medicare beneficiaries. It costs you nothing, and the potential savings are real. But Medicare enrollment is just one piece of the deadline picture, because the next item we're going to cover involves a decision that's permanent, and getting it wrong cannot be undone. Number 2, Social Security filing decisions. The window that closes and never reopens. This one carries more long-term financial weight than almost any other decision a retiree makes. And yet the pressure people feel to make this choice, often without complete information, sometimes in moments of financial stress, leads to outcomes that follow them for the rest of their lives. Here's the core reality. You can begin collecting Social Security retirement benefits as early as age 62. But if you claim at 62, your monthly benefit is permanently reduced by as much as 30% compared to what you'd receive at your full retirement age, which is 67 for most people currently approaching retirement. And if you delay beyond your full retirement age, your benefit grows by 8% for every year you wait, up until age 70. The difference between claiming at 62 versus waiting until 70 can be hundreds of dollars per month, for the rest of your life. And for a surviving spouse, that number matters too, because survivor benefits are based on what the deceased spouse was receiving. Now here's where the deadline element comes in. There are specific situations where timing is everything, and where a window exists that cannot be reopened. If you filed for Social Security and you're within 12 months of that filing date, you have a one-time option to withdraw your application, repay any benefits received, and refile later at a higher amount. That withdrawal window is exactly 12 months. Miss it, and the option is gone. Additionally, if you've reached full retirement age and are still working or have other reasons to delay collecting, there's a specific strategy around when you suspend benefits that can affect what a spouse receives in the meantime. The rules around this changed in 2016, and many people are still operating on outdated information. And then there are the people who simply haven't filed yet and are approaching 70, the age at which delayed credits stop accumulating. Waiting past 70 gains you nothing. If you're already past your full retirement age and haven't filed, the clock is ticking on your potential delayed retirement credits. The action step here is to create an account at ssa.gov if you haven't already. Look at your estimated benefit amounts at different filing ages. If you're within a year of a filing you regret, find out immediately whether you're still in the withdrawal window. And if you're approaching 70, make sure you understand exactly when to file to maximize what you receive. What comes next in our list involves a program that resets every single year, and the deadline to act is closer than most people think. Number 3, extra help with Medicare drug costs, an annual program. Most seniors don't reapply for. There is a federal program called Extra Help, also known as the Low-Income Subsidy, that helps Medicare beneficiaries with limited income and resources pay for their prescription drug costs. We're talking about help with premiums, deductibles, and co-payments for Part D coverage. For people who qualify, this program can be worth over $5,000 a year in savings. Here's what most people don't know. Eligibility for extra help is not permanent for everyone. Some people are automatically enrolled, primarily those who receive full Medicaid or supplemental security income. But many others who qualify based on income and assets must apply, and in some cases must reapply when their circumstances change or when they're flagged for a redetermination. The Social Security Administration conducts periodic reviews of extra help eligibility. If your income or assets changed, even slightly, you could be in a different eligibility category than you were last year, and people who fall off automatic enrollment due to changes in their Medicaid status may need to proactively reapply to maintain their subsidy. Beyond extra help, there is the Medicare Savings Program, a set of 4 state-administered programs that help with Medicare Part B premiums, Part A premiums for those who have them, deductibles, and coinsurance. These programs are income-based and require annual redetermination in most states. Miss the redetermination window, and you lose coverage until the next cycle. The numbers here are significant. The Part B premium alone is well over $170 per month in 2025. For a lower-income senior, having that premium paid by a Medicare savings program means over $2,000 a year that stays in their pocket. And yet enrollment in these programs consistently falls short of the eligible population. Millions of people who could be receiving this help are not. What do? Call Social Security at 1-800-772-1213 and ask specifically about extra help eligibility. Contact your state Medicaid office about Medicare savings programs. If you applied previously and were denied, it's worth applying again. Income and asset rules change, and a denial one year doesn't mean a denial forever. And if your income has dropped since you last applied, that's even more reason to look again now. Here's where things get really interesting, because the next item involves a change that happened recently and that is actively affecting seniors' benefit amounts right now. Number 4, the Social Security Fairness Act, recent changes that may owe you back pay. This is one of the most significant Social Security developments in decades, and a significant portion of the people affected by it still don't know it applies to them. For many years, two provisions in Social Security law, the windfall elimination provision and the government pension offset, reduced or eliminated Social Security benefits for millions of Americans who had also worked in jobs not covered by Social Security. This primarily affected teachers, firefighters, police officers, and other public employees in states where those workers paid into a separate pension system rather than Social Security. The Social Security Fairness Act, which was signed into law in January 2025, eliminated both of these provisions. That means millions of retired public employees and their spouses or survivors who were previously having their Social Security benefits reduced are now entitled to higher monthly payments, and in many cases they are also owed retroactive payments going back to the date the law took effect. The Social Security Administration has been working through an enormous volume of cases to recalculate and adjust benefits for affected individuals, but the process takes time, and not everyone has been reached yet. If you or a spouse worked in a public sector job, as a teacher, municipal employee, law enforcement officer, or in any government role that had its own pension system, and you've been receiving a reduced Social Security benefit because of WEP or GPO, your situation may have changed. The action step here is direct. Go to ssa.gov or call Social Security and ask specifically whether your benefit was previously subject to the windfall elimination provision or the government pension offset. If it was, find out what your new benefit amount should be and whether you are owed retroactive payments. Do not assume this has already been handled automatically. Follow up directly and make sure. And now we come to the final point, and I meant it when I said at the beginning of this video that this one may be the most important of all. Number 5, state benefit deadlines. The local programs that disappear if you miss the window. Everything we've talked about so far has been at the federal level, but some of the most impactful programs available to seniors operate at the state and local level, and they come with some of the strictest deadlines of all. We're talking about programs like the property tax exemptions and freezes we've covered before, but also pharmaceutical assistance programs, utility assistance programs, food benefit programs, and housing assistance. Programs that are funded annually, that require annual applications or renewals, and that have hard cutoff dates after which no new applications are accepted until the next cycle. The Low-Income Home Energy Assistance Program, LIHEAP, helps lower-income households pay heating and cooling bills. It operates on an annual funding cycle, and in many states runs out of money before the application window officially closes. In other words, it's first come, first served. If you're eligible and you wait, the funds may simply be gone. State pharmaceutical assistance programs, which help seniors who fall in the gap between Medicaid and full Medicare drug coverage, often have enrollment periods that align with the calendar year. Miss the window, and you wait 12 months to try again. Supplemental nutrition assistance program benefits, what many people still call food stamps, require periodic recertification. If a recertification deadline is missed, benefits stop. They can be reinstated, but there may be a gap in coverage, and the process to restart can take time. And then there are benefit programs that are genuinely time-limited, funded for a specific period, available to a specific number of applicants, and gone when the money runs out. These include some rental assistance programs, some caregiver support programs, and some state-specific senior financial assistance funds that are created through budget processes and can disappear in the next budget cycle. The action step here is to contact your local area agency on aging. Every part of the country has one. They maintain current information on what programs are available locally, what the deadlines are, and how to apply. You can find your local agency at eldercare.acl.gov or by calling the Eldercare locator at 1-800-677-1116. This is a free service and it exists precisely for this purpose. Let me bring everything together because there's a lot on the table here and all of it matters. We covered Medicare's annual enrollment period, a hard December 7th deadline that locks you into your coverage for a full year, and why comparing plans every fall is worth real money. We talked about Social Security filing decisions, the permanent nature of when you claim, the 12-month withdrawal window, and why getting this right may be the single most financially impactful decision of your retirement. We walked through Extra Help and Medicare savings programs, annual programs that require action to maintain, programs that millions of eligible seniors are not currently enrolled in. We covered the Social Security Fairness Act, a landmark 2025 law that may entitle you or a spouse to higher monthly payments and back pay right now, and we talked about state and local benefit deadlines, the programs that run out of money, reset annually, and disappear if you miss the window. Here is the one thing I want you to carry away from everything we've covered today. Every single one of these programs, protections, and opportunities requires you to act. None of them come to you automatically. The deadline doesn't wait while you get around to it. The enrollment window doesn't extend because you were busy. The money doesn't show up unless you apply for it. So here's what I'm asking you to do right now. Pick one thing from today's video, just one, and look into it today. Not this week, today. Whether that's checking your Medicare plan options, calling Social Security about the Fairness Act, or reaching out to your local area agency on aging to find out what programs you might be missing. One step, today. And then share this video with someone you care about, a parent, a sibling, a neighbor, a friend who's approaching retirement. Because the information we covered today doesn't just apply to you, it applies to millions of Americans who are going to miss these deadlines simply because nobody told them in time. If this video was valuable to you, please hit the like button right now. It genuinely helps us reach more people who need to hear this. Subscribe so you never miss an update, and leave a comment below telling me which of these 5 areas was most relevant to your situation. I read those comments, and your feedback shapes the content we create. Thank you for watching, and I'll see you in the next one.